We're going to talk all about the skin and hair changes that can occur with menopause. A lot of changes happen during that time. And finally, doctors are taking notice and they are helping their patients with this situation and with the changes that occur in women's bodies and their skin after menopause. I mean, for hundreds of years, the healthcare industry essentially has ignored women who have gone through this change. And they've told them that this is just natural, live with it, there's nothing you can do about it. And the fact is that there is a lot that you can do about it. You don't have to do anything about it if you don't want to. But if you are finding that your skin, your hair, your body composition has changed with menopause or is changing with perimenopause, you don't have to just accept that that's just the way it's going to be. You can make specific changes that can basically reverse some of that those processes going on. And so I'm going to talk about that specifically with your hair and your skin today. So, what can happen with menopause and perimenopause? Well, the first thing is that you can notice that your skin is getting thinner. We lose collagen in the skin, and I'll get into that in a little bit. You can also see an increase in fine lines and wrinkles of your skin. You can see skin drooping and skin sagging. Now, this may not occur right away, but you may notice 5-10 years in that you're really noticing the skin feeling like it's sagging and it's drooping. You may notice that your skin is drier. You know, it used to be people would just say, oh, your skin is mature, it's drier. Well, I mean, there are reasons for that, and we can describe why and what you can do about it. You may also notice an increase in facial hair as you go through perimenopause and menopause. Women notice an increase in sunspots and age spots. You can get hyperpigmentation that maybe you didn't have before. And some women in perimenopause and menopause can notice an increase in adult acne. Yes, as if you are a teenager again, you're breaking out. What is going on? So there's a number of causes of this, but the causes, most of it basically stem from the loss of estrogen, lower levels of estrogen in your body as you go through these changes. Now, these lower levels of estrogen can cause a lot of things to happen. You can get sleep disturbances. A lot of women, when they start going through perimenopause, they've gone through menopause, they notice that I can't sleep through the night. You know, I'm noticing that I can't sleep the 7-8 hours straight that I used to, and now I'm waking up in the middle of the night and I can't fall back asleep. Having lower levels of estrogen can impact that. And if you're not sleeping well, then you may find that your skin suffers for it. The more stress we're under, the less rest that we get, the more our skin actually will age. So these sleep disturbances that can be caused by lower levels of estrogen can prematurely age your skin. You may also find that having these lower levels of estrogen can result in increasing amounts of stress. Now, there is a direct correlation between low estrogen potentially and changes in the mood and all of that type of stuff. But also your stress can increase because of what those changes in estrogen do to your body. So for example, your estrogen levels drop, you're not sleeping that well, and now you're stressed about it because you're not sleeping well, you're not well rested, and you're not reacting ideally the way you want to during the day as if you would if you were not sleep deprived. Also, these changes in mood can happen because maybe you're seeing undesirable changes in your body. You may notice that, geez, I am gaining weight and I'm doing the same thing. I mean, how many women have I talked to who are perimenopausal or menopausal who tell me, Dr. Youn, I'm eating the same way, I'm exercising the same way as I did before, yet I'm gaining weight and it just does not make sense to me. Like anything I do doesn't seem to work. Honestly, my friends, I hear this almost every day in my office. And these changes can be due to the perimenopause and menopausal transition. Now, when you go through perimenopause and menopause, you may also notice an increase in male androgens, especially testosterone. And this increase in testosterone can increase adult acne. It can cause more oily skin of your face and more acne type of issues. And one thing that you may have heard from me if you listen to this podcast a lot, if you watch my videos on social media, is that women who go through menopause lose a significant amount of collagen in their skin. It is estimated that in the first 5 years after menopause, women lose 30% of the collagen in their skin in just those 5 years. And then they lose upwards of 2% a year after that. Now, this is compared to men and premenopausal women who lose about 1% of the thickness of collagen. So those 5 years after menopause, that's really significant, 30% of the collagen of your skin. And the collagen is what causes your skin to feel tight, to look thicker, to look taut, and to look youthful. That starts breaking down and the skin gets looser, it gets rougher in texture, it looks more aged. So we know now what is causing the changes that occur in your skin, in your hair, and all of that during menopause and perimenopause. Now let's talk about what you can actually do about it. So the first thing you want to talk about is to talk with your gynecologist about whether hormone replacement therapy may be right for you. Now, interestingly, if you listen to my podcast, I would encourage you. I did a podcast, maybe a year and a half ago now with Dr. Mary Claire Haver, where we talked all about her new book, The New Menopause, and all about hormone replacement therapy and the fact that it was demonized for so long. And this is changing. Doctors are realizing that hormone replacement therapy is not this dangerous thing that they believed for a long time. There was a women's health study that came out back in the 90s that essentially scared people away from estrogen, from hormone replacement therapy. And so for decades, women didn't take it and they just went through these changes and kind of suffered through it as their gynecologists are telling them that that hormone replacement therapy was dangerous and they shouldn't do it. Now, if you have a history of breast cancer, if you have a family history of breast cancer, then these are discussions you'll want to make with your doctor before necessarily starting yourself on HRT. But what's come out now is that the belief is that for the vast majority of women, hormone replacement therapy can be potentially beneficial for them as they go through this menopausal transition and afterwards. And the idea is that it can be protective. If you are healthy prior to starting HRT, the idea is it can help to maintain your health as you get older. And there are studies that are showing that it can impact the collagen content of your skin and so much more. So first thing you want to consider as you're going through perimenopause, and especially if you've gone through the menopausal transition, is should you get on hormone replacement therapy? Now, once again, it used to just be used for people who have hot flashes. They go, well, if you don't have hot flashes or that's not a big issue for you, then don't go on it. There is so much more that HRT can do. And it's beyond the scope of this video where we're just talking about skin and hair changes. Take a peek at some and listen to some of my older podcasts. Like I said, the one with Dr. Mary Claire Haver is great. I also did one with Tamsin Fadal and she has a book, How to Menopause, and that came out probably about 3 or 4 months ago. So definitely take a peek at that one as well, where we really talk about menopause and hormone replacement therapy. So that's the first thing you need to consider. Typically, people for HRT, you want to be ideally within 10 years of that menopausal transition. And menopause, essentially, you're in menopause for 1 day. And that is when you have gone 1 full year without having a period. And once you're at that day, anything after that is postmenopause. Anything before that is premenopause. And some doctors are recommending to consider if you're going to go on HRT to do it within 10 years of menopause or when you're under the age of 60 to start that up. Okay, so what else can you do other than HRT? I do recommend that there are certain nutritional supplements that can really help your hair, your skin, and your nails as you go through menopause and afterwards. And the first thing I recommend is collagen. I am a huge fan of collagen. I actually drink collagen in my hot water. I put a scoop of my Youn Beauty supplemental collagen in my hot water most mornings. And collagen itself basically is a large protein. As I mentioned earlier, it is that component of your skin that causes your skin to feel tight and to look youthful. It makes up about 70 to 80% of the thickness of our skin. As I mentioned a few minutes ago, women lose 30% of the thickness of collagen the first 5 years after menopause. So it makes sense that taking a collagen supplement, getting that collagen back in your system can potentially help to fight that collagen degradation. So is it true? Has that been proven that actually works? And the answer is yes, it has. There have been several huge studies, meta-analyses, where they actually take smaller studies, they group them together to get more power to to the overall group of them to determine whether these types of interventions work. And they find most of them, you stay on a hydrolyzed collagen supplement for about 2 months. That's when they test you, and they find an increase in the hydration of the skin, an increase in the elasticity of the skin. And when they do biopsies and they draw blood, they find an increase in the collagen content in both the skin as well as in the bloodstream. And so it's pretty well established now that taking a daily hydrolyzed collagen supplement can definitely impact the health of your skin, can support that collagen of your skin. I'm a big proponent of it. In full disclosure, our number one selling product at younbeauty.com is our Youn Beauty Supplemental Collagen. We have almost 1,000 people every month that have it on reorder and that literally get it every month, every other month. Some people get it, the 2-pack, but we do get this. I mean, it is our number one selling product by far. And it's because it works and people just stay on it. I saw a patient actually a couple days ago, and beautiful woman. She was in her early 70s. I swear she looked like she was 50, 55. And she said, Dr. Youn, I've been taking your collagen supplement every day for the past 2 years. And I thought, wow, she looks fantastic. So the first thing I would recommend would be to take a daily hydrolyzed collagen supplement. You want to make sure it's hydrolyzed because hydrolyzing collagen takes a large protein that may not get absorbed through your gut, and it breaks it down into individual amino acids and short chains of amino acids called peptides that allow your body to basically absorb it into the bloodstream. So make sure it's hydrolyzed collagen peptides. Our Youn Beauty Supplemental Collagen has verisol, which is a very highly regarded bovine or cow-based collagen in it. And so that's the first nutritional supplement I would recommend is collagen. The second one are omega-3 fatty acids, fish oil. Okay, fish oil is anti-inflammatory. It can reduce inflammation of the skin. Just overall, a very healthy supplement. Now, collagen, there's no such thing as vegan collagen, unfortunately. Collagen has to be animal-based. The quote-unquote vegan collagens out there are basically combinations of proteins and vitamin C and stuff like that, but it's not true collagen. That's different with omega-3 fatty acids. You can get fish oil, which is what most people will take. Make sure it's high-quality fish oil. We have our Youn Beauty omega-3 fatty acid supplement that we have available at younbeauty.com. That's the highest quality fish oil. But if you are vegan, there are also algae-based omega-3 fatty acid supplements out there that you can take as well. So I do recommend taking an omega-3 fatty acid supplement every day, whether it's fish oil or algae-based, whatever you decide. Fiber and probiotics are super important as well. Okay, fiber is really helpful because it's going to help with your, both of them are going to help with your gut microbiome. Fiber is essentially a prebiotic. It is the food for your probiotics, for the microbiome, those trillions of bacteria in your gut. Taking a daily probiotic, I usually recommend at least 3 billion colony-forming units per day is also a way to replenish that healthy microbiome in your gut. And so fiber and probiotics, super important. I do recommend a multivitamin as well. Real quick, when you're talking about fiber and probiotics, you may say, okay, so you want a healthy gut, but what does that do to your skin? Well, there is a direct connection between the health of your gut and the health of your skin. And so if your gut is healthy, there are studies now coming out showing that will impact the health of your skin. But if your gut is unhealthy, if it's inflamed, then you can see inflammatory type of skin conditions basically from that. And so that's a big reason to take fiber and probiotics to keep that gut nice and healthy, and that will show up in your skin. Okay, once again, now, the next one I do recommend is a multivitamin. In general, there's a lot of them out there. We have one at Youn Beauty. We call it our Skin and Hair Support, filled with vitamins and minerals. I think it's fantastic. Take a look at it if you want. It's really, I think, the best multivitamin out there. I'm really, really proud of it. So that's one to consider. But really, the idea is that our food is not as nutritious as we ideally want it to be. Even if you're eating like tons of fruits and vegetables and a nutrient-dense diet, I usually still recommend taking a daily multivitamin because you want to get all those vitamins and minerals that you need. And then if you find, that you're losing hair, which is very common in women after menopause, their hair gets thinner, then there is Nutrafol Women's Balance. And this is a multivitamin from Nutrafol. This is not my company. This is a separate company that makes supplements for people with thinning hair. They have a supplement for for women who are premenopausal, that's Nutrafol for women. And then they have a separate one for women who are postmenopausal, that's Women's Balance. It's, I think, 4 capsules a day. It's filled with vitamins and minerals and adaptogens and antioxidants. And this way, if you've got thinning hair, this will help to support that, to get that hair to grow thicker. If you are on a multivitamin, you may want to not take that if you're taking the Women's Nutrafol Balance, because you may get too many of some of those fat-soluble vitamins. So take a look at that. If you're at all concerned, talk with your doctor before you get started on these, because yes, you can get too much of certain vitamins and minerals and other type of supplements if you're doing too much of it. So that's really what I recommend supplement-wise. Collagen, omega-3 fatty acids, a fiber supplement, probiotics, multivitamin, and then if you're losing hair, you've got thinning hair, then I recommend to go with the Nutrafol Women's Balance. All right, now let's talk about the skincare routine, because this is what a lot of people ask. What do you do for your skincare routine if you've gone through menopause? So we talked about some of the changes in the skin that can occur with menopause: thinning of the skin, loss of collagen, dryness of the skin, increase in sunspots and age spots. And so the skincare regimen needs to change to accommodate those changes so that you can ideally fight those changes off. So the first thing you want to do in the morning is you want to start by cleansing your skin with a milky or a hydrating cleanser. Okay, a more foaming cleanser is going to be drying to your skin. And if you've gone through menopause and your skin's kind of drying, then it's not a bad idea to go more towards a milky or hydrating cleanser so that you're not getting rid of more of the skin's natural oils than you want. So that's what you want to do in the morning. Then I recommend an antioxidant serum with the vitamins C and ideally E. Now, vitamin C is super important for the skin because it acts as an antioxidant. It fights free radicals. Free radicals basically are these damaging molecules that are created by our own metabolism, but they're also created by pollution in the air, by eating ultra-processed foods, by automobile exhaust, by cigarette smoking, and all these unhealthy habits can create these damaging molecules that are basically called free radicals. And what they do is they damage the DNA of our cells and is one of the main causes of aging of our body and aging of our skin. So how do you fight these free radicals? You fight them with antioxidants. Vitamin C is a very potent antioxidant. It's the easiest one to find. Most skincare companies have a vitamin C serum available. Youn Beauty, we have our vitamin C antioxidant serum where we combine vitamin C and vitamin E for a synergistic effect. And so you want to apply a vitamin C, ideally with E serum every morning. Not only does that fight off free radicals, but vitamin C is also super essential in the production of collagen. And we just talked about how important collagen is. Then the next thing I recommend is a brightening cream that ideally contains brightening ingredients like kojic acid, like licorice root extract, like niacinamide. Because once again, women going through menopause often will see an increase in pigment in their skin, hyperpigmentation. So that brightening cream is really going to fight that off. And those 3 ingredients, kojic acid, licorice root extract, and niacinamide, are in our Youn Beauty brightening cream. They're in other ones, so if you have one that you get at the drugstore, by all means, feel free to use that. But I do recommend a brightening cream at this age. And then you ideally want to apply, if you need it, a moisturizer with hyaluronic acid and or ceramides and or antioxidants. I'm a big fan of using combination therapy. So if you're going to buy a moisturizer for your skin, why not pick one that also has some type of anti-aging benefits? Okay, so hyaluronic acid and ceramides are great for moisturizing your skin, and we have them in a lot of our products, but they're not going to do anything to truly fight the aging process. So ideally, if you're going to use a moisturizer, make sure it has something in addition to just those things in it, because you ideally, hey, if you're going to apply it on your skin, why not have one that has antioxidants in it or bakuchiol or peptides or something like that, because then you're doing more than just moisturizing. And then the final thing in the morning is a sunscreen, at least SPF 30. If you have a history of melasma, you may want to up that SPF to 50 or more. And that's what you do in the morning if you are menopausal, postmenopausal. So let me recap that. You want to cleanse with a milky or hydrating cleanser as number 1. You want to apply an antioxidant serum with ideally vitamin C and E as number 2. Number 3, you want to apply a brightening cream. Number 4, a moisturizer, ideally with some anti-aging ingredients in it. And then number 5, do a sunscreen, at least SPF 30. That's the morning skincare regimen. Okay, what do you do at night? Well, because if you are wearing makeup, then ideally you want to consider doing a double cleanse. And if you double cleanse, you can double cleanse either with a micellar water or with an oil cleanser. In general, if you're perimenopausal, postmenopausal, you may be noticing your skin is getting drier. I would recommend going with a makeup removing oil cleanser as the first step of your skincare routine at night. What that's going to do is going to help to remove the dirt, the grime, the oil, the pollution, and your makeup before you do a second cleanse where you would cleanse then with that milky or hydrating cleanser, probably the same one that you used in the morning. You're really going to get your skin nice and clean, but you're also going to avoid, by doing this, you're going to avoid stripping it of its important oils. After you double cleanse, then you want to apply a retinol. Now, retinol itself can be fairly aggressive. There's also retin A, and some people, if you've got pretty oily skin and you tolerate retin A, which is prescription strength, then by all means go ahead and use it. The stronger it is, in general, the more changes you're going to see. For the rest of people, there is retinol. Retinol is over the counter. It is non-prescription strength, but still for some people, they may find that that's too strong for them. Retinol can create some dryness of the skin. It can create some flaking of the skin, some temporary irritation of the skin. And if you're seeing that and you want to avoid that, then maybe go for bakuchiol. A bakuchiol-based cream. Bakuchiol is made from the leaves of the bobchi plant. This is a kind of a naturally occurring moisturizer and anti-aging ingredient. And one study compared it head-to-head to retinol and found very similar effects, but with less skin irritation. So most dermatologists, plastic surgeons will say, no, go with the retinol first. If you don't tolerate it though, then I recommend going with a bakuchiol. And 2 of our top-selling products in Youn Beauty are our retinol moisturizer and our peptide and bakuchiol moisturizer. And then after the retinol, I do recommend, if you're in menopause, to add a peptide type of cream to it. You can do like our peptide and bakuchiol moisturizer, or you can do a separate peptide cream. Peptides are important because these are short chains of proteins that will actually stimulate the production of collagen. They basically send cellular signals to your skin to create more collagen. And once again, as you go through menopause, we lose collagen. So this is very, very important. And then you want to follow that up with a night cream, ideally one that contains ceramides, maybe one that contains some active ingredients like a bakuchiol or something like that. But if, night creams are more important for people after they've gone through menopause than before, because once again, you may be dealing with drier skin at that point. And so applying more of a thicker night cream that can help to moisturize your skin and lock in that moisture can be much more helpful for some women as they've gone through menopause. Okay, so that's what you do at night. Let me just repeat that because I repeated the morning. You want to double cleanse. Start with an makeup removing oil cleanser. Follow that up with your gentle or your hydrating cleanser after that. Then you want to apply a retinol and or bakuchiol, depending on whether you tolerate retinol. Then a peptide-based cream, followed by a night cream. Okay, and some of these you can combine together. So like for us, we have our Youn Beauty peptide and bakuchiol moisturizer. It's a thicker moisturizer, so that's one that a lot of people find they don't need to add a separate night cream. And now you're hitting both the bakuchiol, you're hitting the peptides, and you're getting that nice moisturization at night to lock in that moisture overnight to keep your skin nice and hydrated. And so you can do these separately, or you can, once again, some of these can be put together depending on what skincare product that you buy. And then the final thing for your face is once a week, you want to exfoliate your skin. Now you can do it with a gentle scrub. We have our advanced exfoliating cream, or you can do that with like an alpha hydroxy acid peel. There's a number of ways to do it. But in general, you want to exfoliate your skin. Usually when you go through menopause, you'll find that you need less exfoliation than you did when you were younger because your skin's going to be a bit thinner and because it's going to be a little more sensitive. And so you don't want to create a lot of irritation to the skin. So typically once a week is sufficient for a lot of people after menopause. Now what exfoliation does is it gets rid of that upper layer of dead skin cells. And that by getting rid of that upper layer of dead skin cells, it kind of clumps and accumulates on your skin. What it will then do is it will send a cellular signal to the deeper layers of skin and tell that to turn over more quickly. Because when we're younger, our skin turns over maybe every 6 to 8 weeks. And that's fairly rapid as a new skin cell is created at the base of the skin near the hair follicles, and then it goes all the way up to the surface and then sloughs off. That process slows down as we get older, and you start getting clumping of the upper layer of skin cells. When you exfoliate that, you get rid of that layer, then that cellular signal happens, and once again, the skin cells start turning over more quickly, and the skin looks and feels softer and smoother. Okay, so we talked about the face. What do you do with the body? Well, the first thing I recommend, like the facial skin that gets drier, you may notice that the skin of your body gets drier as you've gone through menopause. And so the first thing I recommend is to apply a moisturizer within 2 minutes of exiting the shower. Do not wait, okay? Because you want to lock that moisture in from the shower. So apply that moisturizer within 2 minutes of getting out of the shower. You may want a dry brush. There are a lot of organic bristle brushes that you can buy just on Amazon and stuff. And dry brushing can help to exfoliate that skin. That can help with the moisturization as well. The another thing you can do is you can exfoliate with Korean washcloths. Korean washcloths, I swear, they're basically like sandpaper, and they are painful. And they work though, because they will really exfoliate your skin. So be gentle with yourself, but at the same time, sometimes people like a good scrubbing with those Korean washcloths. And one thing I'm really excited about, I don't know if it's going to be out by the time this podcast airs. It might be. We're hoping to get it out by then. Is we do have Youn Beauty. We have a body retinol moisturizer coming out very, very soon. And it's going to be in a pretty darn large tub. You apply this onto your skin. Not only is it going to be moisturized to your skin, but it's got a bit of retinol to help with the anti-aging process as well. And so retinol is not just for your face. We're coming out with it for your body here very soon. Definitely, if you're not on our email list, would encourage you to join our email list. Just go to my website, dryoun.com. You can sign up for one of those free little ebooks, and then we'll get you on that mailing list. Or you can sign up at younbeauty.com as well. We've got links in the podcast caption as well. If you want to get that body retinol moisturizer when it comes out, it's going to be out very, very soon. Okay, so we talked about the skin, the skincare regimen, talked about supplements. How about other specific issues that can occur with menopause? The first thing, and we mentioned a little bit of it, is thinning hair, okay? Very common. Women go through menopause and their hair gets thinner. It's not as strong afterwards. It feels like it's not as robust and as thick and as luxurious. So the first thing I recommend is to consider, as I mentioned earlier, Nutrafol Women's Balance. Okay, some of this can be due to nutritional deficiencies, and that Nutrafol Women's Balance can definitely help with that. We do have that. We'll have a link here in the caption if you want to check it out. We have it at younbeauty.com. I don't own Nutrafol, but because I find that product to be so helpful, I take Nutrafol for Men myself, that we do sell it at our younbeauty.com online store. Another thing with thinning hair is reducing stress. We do know that there's a condition called telogen effluvium. And this condition basically is a condition where if you are real stressed, it can cause your hair to fall out. I think I see this with a lot of patients after surgery. They go through a stressful time with surgery. They go through general anesthetic and stuff, and their hair gets thinner afterwards. They start noticing their hair falling out. And eventually it comes back as they get through that whole process and get on the other side. So if you're listening to this right now and you said, look, I've gone through menopause, and honestly, Dr. Youn, I'm really stressed. My hair is getting thinner. My skin is changing. I'm not sleeping well at night. Then trying to reduce that stress can really potentially help. Meditation, yoga, therapy, whatever it takes for you to reduce your stress, really try to do that. Take care of yourself, because that taking care of yourself in that way can impact things like cosmetics, like your hair, like your skin, and all of that. Okay, so reducing stress by meditation, by trying to get better sleep, by therapy, all of that can really help too. I do recommend, if you've got thinning hair, to consider a laser helmet. There are a number of good ones out there. Some brands to look for are iRestore. Current Body has a good one. And so what these are, essentially, they're helmets that have lasers on the inside. These are low light lasers, so these are not hot lasers that we use, let's say, to zap wrinkles, but they're considered low light lasers. And what they do essentially is that they increase the energy in the hair follicles, causing the hair follicles to go into a growth phase. And there are a lot of studies that show that using these types of laser helmets can cause your hair to get thicker. So definitely would recommend that. Also, I do recommend using some type of a topical. Now, if you really want to go natural, you can use topical rosemary oil. There was one small study that compared topical rosemary oil to 2% minoxidil and found very similar results with thickening of the hair. But you got to keep in mind, this is 2% minoxidil, and most of this minoxidil sold over the counter is 5%. And I myself have been using 5% minoxidil for my hair after using some other different serums and stuff that I didn't feel were doing a whole lot. So like I said, if you want to go real natural, you want to go with topical rosemary oil, by all means do that. If you want something more effective as a topical, then 5% minoxidil, whether for men or women, it's basically the same thing, is what I would recommend. And then if those things aren't doing it, the hair is getting thinner. Let's say you're on hormone replacement therapy, you're taking Nutrafol Women's Balance, you're reducing your stress, you're meditating, you've got a therapist, you're using a laser helmet, you're trying minoxidil and or rosemary oil, those aren't doing it, and you want to do something more active, you can consider PRP injections into the scalp. PRP is where we draw your blood, we remove the platelets, which are chock full of growth factors, and then we inject that into areas of the scalp where the hair is thinning. And it does work, but that is an invasive procedure. You do have to repeat it typically a couple times a year, but it does definitely work. Okay, so two other things I want to briefly mention, skin issues that occur with menopause, after menopause. First thing is acne. So you can develop adult acne after menopause. We mentioned earlier that the testosterone sometimes that goes up after menopause, that can have a potential cause to it, but it is multifactorial. So the first thing you want to do for acne is to use a salicylic acid cleanser. Salicylic acid, unlike, let's say, alpha hydroxy acids, salicylic acid, which if I remember right, it's a beta hydroxy acid, that will actually penetrate the oil glands much better than, let's say, an alpha hydroxy acid. And so that's why salicylic acid washes are so popular in people who are in acne type washes and acne systems, because it really gets in and cleans out those pores. So would recommend a salicylic acid cleanser if you've got acne issues. And then what you want to do is you want to look at, with acne, the problem with acne is it's so multifactorial. There's so many things that can impact having acne. You know, acne is an inflammatory condition. You can get some chronic inflammation after menopause. So it's an inflammatory condition. It can have some relation to the health of your microbiome. Stress can impact acne. Obviously, hormonal changes can impact acne. There's so much out there that can do it. So what you want to do, number one, is to see a good dermatologist. And some things that you can do that can potentially help is you can take a daily probiotic. This can help to stimulate and support a healthy microbiome. You can also get on a very low dose antibiotic. Minocycline can be used at very, very low doses, kind of sub-antibiotic doses, even though it's an antibiotic, and it reduces inflammation. And studies show that after you stop taking it, within about 48 hours, your microbiome gets back to normal. And so doing minocycline, like a low-dose antibiotic, can be used as an anti-inflammatory effect. You stay on it for a short period of time just to kind of tamp things down to get back to hopefully where you want to be. Benzoyl peroxide, very popular acne treatment, still very popular today, has been for decades. That's another option. Hormone replacement therapy, for some people that can help with their acne just because that, once again, is one of the potential causes. And then, as you know, if you listen to my podcast, doing things like reducing your ultra-processed foods, reducing how much sugar you eat. Dairy could be also an issue here too. So trying to, alter your diet to reduce inflammation. Those are kind of three main components that will increase inflammation via the diet: ultra-processed foods, sugar-filled foods, and dairy. So trying to reduce the amount that you eat of those types of foods can potentially help with acne as well. Acne is a tough issue. Adult acne, would definitely encourage you to see a dermatologist if you're dealing with that. And then hirsutism. Hirsutism is hair growth that's more of a male pattern hair growth. So a lot of women, they go through menopause, they're like, why am I getting these long hair, dark hairs going out of my chin and other areas that they normally didn't have before? That can also happen too. And so doing things like laser hair removal is very helpful for some women. And then electrolysis, if that hair is, let's say, gray or it's blonde, then laser hair removal isn't going to work so much for that. Doing things like electrolysis can help. So these are some of the things you can do to help with your skin and hair changes in menopause. One thing that I did create after creating this podcast episode was a menopause skincare routine that includes all the products you need for if you have gone through that menopausal transition. It includes the cleansers, the bakuchiol, the retinol, the vitamin C, even the collagen, all that. Everything you need is in this bundle product. If you just don't know what to get, then this is what I recommend that you take a look at. We have it at younbeauty.com. We're going to put a link in the caption of this podcast as well, linking you to that product bundle. If you're interested, definitely check it out. It's a lot of products, but it will basically cover everything for you. I think it's everything except like a probiotic. So it's basically everything that you need. Take a peek at it. And I hope this was helpful for you. If you can't afford my products, you don't have to use mine. There are a lot of great drugstore brand products out there. Just try to look for ones that don't have all the added fragrances in it, that, less additives and preservatives, because you're going to have a better chance that your skin's going to tolerate that product much better. All right. Well, I hope this was helpful for you. If you've been enjoying this podcast, just if you could take 2 minutes to leave a rating or review on iTunes or Spotify, it really helps us spread the word. And as always, we always give shout outs every week to somebody who does. So thank you so much for listening. My name is Dr. Anthony Youn. This is the Doctor Youn Show. As always, I'll leave you with eat real food, use clean skincare, and auto-rejuvenate before you operate.